Well, we're here with Dr. Beck, a medical doctor, actually a doctor specializing in nerves very much so, from Huntsville, Alabama. Hi, Dr. Beck.
Hello.
Dr. Beck, I want to ask you, lots of people have, kind of shoulder neck pain. In fact, they also have lower back pain and back pain, period. But let's concentrate on shoulder and neck pain a little bit. And tell us a little bit about some of the causes, but very importantly about some of the treatments available and how it relates to nerves and all that stuff.
Mm-hmm. Well, shoulder and neck pain are really common, and actually one of the most common things I see in my practice. Now, you can have shoulder and neck pain for a variety of reasons. One, you can have discs that are herniated. You can have arthritis in your neck. And then you can have simple muscle strains and strains and sprains. Such as when you've had a car wreck, your head gets thrown back and forth, and people have that neck and shoulder pain. So there's really three main kinds of neck pain that I deal with. And there are a variety of treatments. As I always emphasize, one of the main things in treating neck and back pain is to figure out what's causing the pain. And
did you say, sorry to interrupt you, but did you say there are three varieties of neck pain you're treating?
There's three different causes that I commonly run into with neck pain.
I see.
The first would be a herniated disc in the neck. Okay. The second would be arthritis in the spine of the neck. And the third would be a strain or sprain of the muscles and ligaments in the neck.
Okay, got it. You did say that. I just, it went by so fast I didn't catch it. All right. Good. So go ahead and how do we treat them? How do you treat them?
Well, as I said, the first thing to do is to figure out what's causing what. And very often this involves some testing. And the first thing you need to do is go see a doctor, have him talk to you, take a good history exam, physical examination, check you out, and then he may need to order some tests such as x-rays to find the arthritis. You may need an MRI to find out if you have a ruptured disc in your neck, and you may need nerve tests to see if you have a pinched nerve in your neck causing pain in your arms or legs. Now, once that's been done, then the doctor can move on to find a good treatment for you. Now, let's take the ruptured disc, for example. A lot of people think they need to rush off and see a surgeon about this, when in fact many ruptured disc or herniated disc in the neck can be taken care of very effectively without surgery. Some very simple treatments that we use are cervical traction. People have the little harness that kind of pulls your head up a little bit and takes pressure off the disc. And very oftentimes people do quite well with this, a very, very simple type of procedure. Now, if you have arthritis, you may need certain medications to help with that. And even if you do have arthritis, exercise is very helpful for neck and back complaints. And, for example, very simple exercises like stretching, strengthening your neck can really help with the pain from arthritis and also from the sprains and strains that I talked about that many people get, particularly with car wrecks, where their head gets thrown forward and backward, and they have what's called, the whiplash type of effect. So there are several different treatments, all of them very simple, and none of them requiring surgery. So these are really what I call first-line treatments for neck and shoulder pain, and oftentimes they're very, very effective.
Are you, I'm not exactly a super exercise guy and stuff like that, but at the same token, I do know a little bit about exercise, and I know that the point is not every exercise helps everything. So you're going to show your patients or the people who come to you what exercise to do to make just that right muscle going correct so that the arthritis maybe goes away or all that.
That's right. One thing I specialize in is what's called therapeutic exercise, and this is where we target specific exercises for the specific problem that you have. And so we really hone in on what's causing your problem by a careful history, physical examination, and laboratory analysis such as x-rays and MRI scans. And then once we figure out the problem and which muscles are involved or if it's arthritis in your neck, then we can give you some very specific exercises to help improve your condition.
Got it. So second stage, or not necessarily second stage, if that first line of defense is not enough, where do we go from there?
We start from simple to the more complex, and exercises are very easy. Anybody can do them. That doesn't involve medications. Normally, the second line would be to look at specific medications to help your problem. For example, if you have very severe arthritis in your neck, it's very likely that you're going to need an anti-inflammatory type medication like ibuprofen or Advil or Aleve of a prescription strength to help get your pain under control. Even so, you may still need to do the exercises in addition to the medication. We also perform injections into the neck area. I have a specific type of injection called trigger point injections in which we inject the muscles and ligaments in the neck to help decrease the spasm that people have. Now, one of the neat things we do with this is we use an ultrasound machine. Now, you may have heard of ultrasound like for checking on how a baby's doing before it's born.
Mm-hmm.
This is the same thing. We can look inside the muscles and tissue of the neck to see what's going on and also to help us guide our injections with these trigger points. And so what we do is we inject medication into the neck muscles and ligaments to help break up spasm and also to really knock down the pain level so that you can do the exercises.
Great. Is there a third stage if that still doesn't work? Or does it sometimes not work?
Some people may consider surgery, but by and large, the majority of neck complaints can be treated very effectively without surgery. So really, maybe just 2 stages.
Got it. Okay. Oh, wonderful. So in terms of those injections, are there any type of, hormone type of injections involved also, or not really?
No, we don't normally use the steroid injections that many doctors do, and a lot of people come in, they're very worried about taking steroids because they know that it can affect their blood sugar and their blood pressure, and, steroids are just it's a very strong drug, and so we use Marcaine, which is sort of like the Novocaine your dentist used to fill your teeth, a very safe drug. We also use a drug called Serapin, which is a vegetable extract, and there's very little side effects from the Serapin, so most people have absolutely no side effects from the medications that we inject, but they have great results.
Wonderful. And how long does such a treatment, with no doubt there's no one fits all, but what are we talking about here? Is it a year, 2? Is it a month or 2? Is it every day, every week? What's give us a good feeling for it.
Well, to start with, for the exercises, you may need to do those at least on a daily basis. And I tell people doing exercises like taking your blood pressure pill is something you have to do once a day to stay healthy. Now, as far as the injections go, we frequently will do those maybe once a week, once every other week, for a period of 3 to 4 injections. And then after about a month, 6 weeks, we may be able to stop the medications. Now, if you have to do physical therapy, that typically lasts 4 to 6 weeks to get a good effect. And obviously with medications, we don't want to use those any longer than we have to. And I find that typically people don't need medications much beyond 6, possibly 8 weeks.
So would you say that there's lots of people running around with unnecessarily neck and shoulder pain, and they write it off to, I don't know, a bad pillow or kind of getting old or whatever it may be, they're writing it off because we seem to be unfortunately, it's good that we people are very adaptive, but we also seem to be very adaptive to pain and just kind of live with it. I know so many people who have sciatic pains, and they just say, it's part of it. I had this, and that's just what it is. And headaches is another thing. I'm not saying that we're talking about headaches now, but people get so used to it. So do you see lots of people out there who have this pain, and by doing so a diminished lifestyle, which they really actually could fix within a month, 2 or 3?
I do, and I think a lot of people, they don't want to take the inconvenience to go see the doctor, to get the testing done, to go through the actual treatment, and they're really surprised once they do it. They go, gosh, I wish I'd really done this sooner.
Yeah, because, thanks God I'm a person who has little or none of those type of symptoms, but I do know, when as I said, I do a little sport, I go skiing, and every so often, or in a karate, and then, you have something which, why it doesn't work, why it hurt, and frankly, those days are miserable is maybe not a right word, but they're definitely handicapping, if you can't turn your neck when you drive and just sit there and work, when you have pain throughout the day, it is extremely and cumbersome, and it really makes life not good. You are not as as alert and thinking in your work, and you're just not as happy, you're more grouchy, you don't want to talk to people as much, and all that, if it lasts a day or two, kind of no big deal. But if it lasts for a long time, this must be very devastating to a person's overall social life.
Oh, it does. It affects everything. It affects your sleep. It affects your relationships. It affects your recreation. It affects your work. I mean, pain is all pervasive. It just gets into everything and makes a mess of everything. And so it's really important not to let it get to that point before it really destroys your life. And the sooner the better. And that's something that I see a lot of people wait way too long. And at that point, it may be that you'll have to go see a surgeon to get it fixed because the simple measures won't work. So we really want to get people in early before things get to be such a mess that your life is just off the track, so to speak. So we really want to get you in early to treat things.
Right. And what people quite often don't realize is that it affects your family, the people around you, be it your kids, your spouse, and your co-workers and grandkids, more than it affects them. Do you know what I mean? It's almost like with bad breath. It doesn't affect you very much. You kind of don't smell it because you get used to it, I guess. But it affects people around you. Do you understand?
Absolutely.
Because the kid walk up and said, "Daddy, let's play," or "Uncle, let's play," whatever it may be, and Uncle goes, "Not today." And it becomes a habit. It becomes like he doesn't think about it anymore, that he never plays. 20 years ago, my wife got, sometimes she thought I was upset with her when we first met, like some 24 whatever years ago, till she finally, a year or two later, figured out that whenever I don't talk on the kitchen table or driving in a car or just, whenever, it's not because I'm upset with her. It's because I was tired and exhausted for whatever reason that was. But basically, when we get into that stage, we become like, and how can our spouses, live life, our kids, our just all people when we live like that? And I think that is a social deterioration which people don't put into calculation, even if they are able and willing to live with the pain.
Oh, that's right. And, when you don't feel good, you're grouchy, you're irritable, and it really kind of affects everything you do, and particularly everybody you're around, whether it be your family, your coworkers, or your clients, or whoever you're working with. So very important to get it treated early.
Well, thank you very much, Dr. Beck, for letting us know that actually there is treatment, that surgery really, in most cases, the way you say, really just simply isn't needed. There's the body is made, it can repair itself if you do the right thing.
Oh, absolutely.
Thank you very much.